In this case study, we'll be going over how to use the habitual joint motion path to recommend running shoes. This, combined with the comfort filter, specifically the RunCat questionnaire, are two of the most evidence-based ways to recommend running shoes. We are no longer advising clinicians to use outdated theories, such as pronation control and impact force modification, when recommending running shoes. For those of you that are Running Specialist Report subscribers, make sure to check out the full report on the latest evidence behind footwear recommendations. So how do we use the habitual joint motion path? We first look at barefoot squatting, followed by treadmill running with padded socks, and then treadmill running with the preferred running shoe. And here's the process. What we want to do is look at that barefoot squat. We want to have the patient go feet hip width apart, toes pointing forwards, arms over the chest, and we're going to have them do 10 squats down at 90 degrees. Now, with that, we're going to look at those joint biomechanics at the ankle, at the knee, at the hip. So we're going to get an idea of their baseline movement. The barefoot squat is their baseline movement. Then we're going to look at treadmill running in padded socks. Specifically padded socks because we don't want to add too much pressure, too much impact that's going to change their running. We're going to get at least 10 seconds. You can use a 2D analysis, 3D analysis. Lateral views, posterior views are good. And so then we go to the treadmill running with the preferred running shoe. Then what we want to look at is, again, all those biomechanics at the ankle, foot, knee, hips. And we want to make sure we can capture at least 10 seconds. So here's the process of how we're going to analyze this, which I'll show you in a video just coming up. So we're going to use that barefoot squatting. We're going to look at the biomechanics. That's our baseline. Then we want to compare that to running without shoes on, so that padded sock running. And then we want to analyze what the difference is between barefoot squatting and barefoot running or sock running. What we want to see is really, is there a large deviation? Is there a small deviation? Do their biomechanics look the same? Is there a vast difference? So we get that difference, or we get that deviation that they're going to show between barefoot squatting and the sock running. Then we're going to have them run the shoe. And here's where the real analysis comes in. What we want is that the shoe running is going to closely mirror the squat biomechanics. However, we definitely don't want the shoe running to change the running in padded socks. Because if you deviate more than the padded socks, even if that deviation is more what we'd consider a proper running form, what we know is that's going to cause more wear and tear. We know that it's going to have a bad result to be able to change the runner's biomechanics that much. So while we want the shoe running to mimic barefoot squatting, we also really don't want that shoe running to deviate more than the sock running. So let me show you a good example of that right now. So here we have a patient, a runner, that's going to be squatting for us. And as they're squatting, you can see that we have a couple biomechanics that are important to look at. So looking at the feet, we can see the right foot's rotated or has some more forefoot external rotation. We can also see that as she squats down, we notice that there's a collapse of the arches. We can also see there's maybe some valgus going medially at that subtalar joint. And then we look at the knees. So we do notice more pressures on that right knee compared to the left knee. And we also can see that the knees come outwards a little bit when she squats. We have some varus forces here. And if we look at the hips, we don't really see a lot of change. We also can see she's putting her hands over. We can see she's leaning and tilting forward quite a bit. So that has some other considerations to think about. But as we have her go through this, we can certainly see there's some biomechanics that are presenting themselves. Forefoot right external rotation. We can see a little valgus collapse of that subtalar joint. We see some varus forces at the knee. So all those things, we want to then compare it to how she's running. So now that we're going to have her go run barefoot, what do we see? Well, we see some interesting presentation. We definitely notice that this sock padded running has a valgus collapse at the subtalar joint. We also see that the arches collapse as well, maybe a little more on the left than the right. We see that right forefoot external rotation. But we also see that the knees have a varus motion. So we definitely see that they're being pushed outwards. And that varus motion outwards is then causing more of the knees to separate. So that's one of the key things I think that she's showing us. We can also see she has some hip drop. On the left side is dropping down comparatively to the right when she's in that right stance. So now let's go ahead and compare her to her shoe running. So these are the Nike Pegasus, and we're taking a look, the Nike Zoom Pegasus, and we're going to look at how she's running. Now, she did say that these shoes are a bit old. They're about 5 years old. She's been running in them for quite some time. Although she doesn't have a ton of mileage on them, she said these are shoes that she had used a bit and was considering getting back into these shoes. So when we look at this shoe for the runner, what do we see? Well, we also see some similarities to that squatting biomechanics. We notice that the arches do collapse. We notice she has more right forefoot external rotation. We also notice that her knees do come outward, although not quite as much as the barefoot or sock running. We also see that she does have that hip drop as well. And so we see a lot of similarities here between her barefoot squatting, her sock padded running, and running her shoes. So in this case, we would say that these shoes are actually following a normal, natural biomechanical movement, or her habitual joint motion path. The reason why is because her shoes don't deviate more than her barefoot or sock running. We also see that they're fairly close to her squatting barefoot as well. This is a good place to make a recommendation for this patient or for this runner. We can say that these shoes are going to encourage her natural biomechanics. Now, the other thing we do here is obviously give her the questionnaire, give her the run cat to be able to determine if this is a comfortable shoe for her. But based on her biomechanics, we can definitely notice that this is in line with the normal biomechanics that she has. This is a great way to understand if this is a safe shoe for the patient, if this is something that is going to be beneficial for her, and furthermore, if this is something that she's going to be successful running in and hopefully decrease the chance for injuries. Check it out. Use this with your runner next. I'd love to hear if this is something that helps you improve your runner's recommendations for running shoes and what your success is with it. Take care and talk to you soon.